Mental health is an issue that has been long ignored. For too long, we've been unwilling and unable to really talk about mental health and the needs that people have. We've tried to say, look, if you have a physical problem, go over here to the left, and if you have a mental problem, go to the right. Well, that's not how human beings operate. And what we need is to take care of the whole person and take care of the healthcare needs of the whole person.
The Meadows Mental Health Policy Institute is a nonpartisan, data-driven policy institute that's dedicated to helping Texans, every Texan, get the mental health care they need. We're not about writing reports, we're about changing policies, changing programs, changing practices so people get the care they need and get care that works. And we do that really through several interrelated strategies. One is that we work with policymakers. The second focus we have is at communities. And then the third area is really look at the public in general, to help the public in general change their attitudes about mental health.
The Meadows Mental Health Policy Institute, for me, has been a big sigh of relief. People have been doing great work for decades in really sort of siloed sort of ways. Then you have a group like MMHPI come along, and they are able to speak all of our languages and then find the fact that we all have very common ground and that we all are in this together, and there is a solution that we can all rally around.
For our Texas State of Mind initiative, we have chosen to start with 3 initial populations: children, Texas veterans, and people with unmet mental health needs who get stuck in our correctional systems, which we call a smart justice focus.
For children's mental health, the time is now, because with all the epigenetics and toxic stress research coming out, we don't have time to waste. We are hurting our kids right now, today, in a way that will affect them for their whole lives. And MMHPI understands that.
We believe the best strategies then are to make mental health care available in integrated treatment settings.
My hope is that within 5 years, maybe 10 would be even tolerable, but that when you come into a primary care office, it's not primary care. They're all integrated, and we don't call it integrated care. Their success would be that it's just health care. And it's just like you get vital signs taken when you come in, you know you're going to meet with a mental health professional if you need one that day.
Texas is exceptionally special for veterans. We actually have the largest number of veterans from the 9/11 conflicts and wars of any state.
The Institute believes, I think as most Texans believe, that we have a special obligation to our returning veterans and to their families to help heal the wounds of war and really welcome them home. A small percentage, but an important percentage of veterans have severe reactions to their combat experience. So if folks don't get mental health treatment to help them manage those symptoms effectively and to heal and recover, then they're not going to be able to come home.
Meadows has put the people together that have created this excitement and stir of novel ideas, and then they have the personnel to actually help people who do not have the skills of translating this to being sustainable.
One of our other priorities at the Institute is focusing on what we call smart justice. These are folks who end up in our correction systems who have severe mental health needs.
In Texas, about 34% of inmates have some mental health need or substance abuse issue, and 17% of those have a serious mental health issue. Smart justice really takes into consideration the intersection between criminal justice and behavioral health. And it's about keeping folks who have behavioral health needs out of the criminal justice system and having them served in the community.
We need to shift and make access to crisis services more accessible, and to help police, sheriff's deputies know where those resources are and make it easy for them to access those resources so that they can divert as many people as possible. One of our biggest priorities of the Meadows Mental Health Policy Institute is to address the stigma that makes it harder for people to talk about their mental health needs than their physical health needs.
A first step in changing public opinion is for people to stand up and raise their hand and say, I need help, and it's okay to need help.
You know, when we've done opinion polling, we've found that people recognize that there's mental health needs, but most people don't know what to do about those needs. What we're trying to do at the Institute is to help people understand that there is effective treatment. we can build more, and when we build more treatment, we make it easier for people to get the care they need, then that stigma is going to be reduced because people have hope.
The encouraging thing in our work in just a year, we can take you to various places in Texas where people are solving problems. It's happening in pockets, and our job is to make sure that happens statewide so that every Texan can get help that needs it.